This presentation is going to focus on the medications that you may have been prescribed for the treatment of your heart condition. It will explain why you may have been given each medicine, how it works, and also any common side effects. If you are taking medication that isn't discussed here, please talk to your GP, pharmacist or nurse about them. The medications that are normally given to prevent further heart problems are listed, and we will discuss them individually during the presentation. Antiplatelet medications help to prevent the blood clotting. It achieves this by reducing the stickiness of platelets. Aspirin, the normal dose is 75 milligrams, taken in the morning with or after food. Possible side effects include gastrointestinal disturbances such as indigestion and stomach upset. The following are examples of antiplatelets which work in conjunction with aspirin. Clopidogrel, usually taken after stent insertion. Normal dose is 75 milligrams in the morning. Side effects may include bruising and increased risk of bleeding. Prasugrel may be prescribed instead of clopidogrel. Normal dose is 10 milligrams per day, usually for 12 months. Side effects may be bleeding, bruising, or a rash. Ticagrelor may be prescribed instead of clopidogrel or prasugrel. Normal dose is 90 milligrams twice a day, usually for 12 months. Side effects may include shortness of breath, bruising, or bleeding. Proton pump inhibitors. A proton pump inhibitor, or PPI, may be prescribed to reduce the amount of stomach acid your body makes. This is usually prescribed alongside antiplatelet medication. Best taken 30 minutes before the first meal of the day. Side effects may include headaches, diarrhea, constipation, nausea, and itching. Anticoagulants are a group of medications prescribed for a variety of heart conditions. The following are examples of these types of medications. Warfarin. Warfarin can be used for irregular heart rhythms and can sometimes be prescribed after heart surgery. It may also be prescribed to help prevent deep vein thrombosis, known as DVT. Regular blood tests are required to check the INR. This stands for International Normalized Ratio. This will help to determine what dose of medication you will need to take. Your INR can be affected by certain foods, alcohol, and herbal medication. Side effects include bruising and a tendency to bleed a bit more easily. DOACs. These are known as direct oral anticoagulants. The following are examples of DOACs: apixaban, rivaroxaban, dapigatran, edoxaban. They are usually prescribed for people who have atrial fibrillation to reduce the risk of a stroke. Medications work quickly, usually within 2 to 4 hours. These medications do not require regular blood tests. It is recommended that rivaroxaban is taken with food as it can have a reduced absorption. Side effects can include nausea, bruising, and bleeding. Beta blockers. Beta blockers may be prescribed to slow down the heart rate and reduce the blood pressure by blocking the hormone receptor adrenaline or noradrenaline. These include bisoprolol, metoprolol, and sotalol. Possible side effects include tiredness and fatigue, nausea, diarrhea, cold hands and feet, erectile dysfunction, and may cause vivid dreams. ACE inhibitors. ACE inhibitors, for example, ramipril, lisinopril, or enalapril, work by making the blood vessels relax and widen, which helps to lower the blood pressure. Side effects include irritating dry cough, dizziness, funny taste in the mouth, a rash, and a drippy nose. ARB blockers. Examples of these are losartan, candesartan, and valsartan. ARB blockers work similar to ACE inhibitors, but are less likely to cause the dry persistent cough caused by ACE inhibitors. Possible side effects are dizziness, fatigue, and occasionally a headache. ARNI. Entresto is a drug used to treat heart failure. It relaxes the blood vessels and helps to get rid of extra salt and fluid to increase blood flow and lower blood pressure. This medication replaces ACE inhibitors or ARBs, and you need to stop these before starting Entresto. Usually a gap of 36 hours is required. Possible side effects may include dizziness and kidney malfunction. If you experience any breathing or swallowing problems or any swelling to the face, tongue or lips, please seek medical advice urgently. Calcium channel blockers. Examples of calcium channel blockers include amlodipine and diltiazem. These drugs reduce the amount of calcium entering the muscle cells of the arteries, causing them to relax and widen and lower blood pressure. Possible side effects include flushing, headaches, dizziness and swollen ankles. Diuretics. Examples of diuretics include furosemide and bumetanide. They are useful drugs in the treatment of heart failure symptoms and help to lower blood pressure. They help the kidneys to get rid of any excess fluid by making you pass more urine. This in turn will reduce swelling in the ankles, legs and other body parts. Possible side effects may include raised glucose levels in diabetics. They can also cause or worsen gout, and some people may experience leg cramps. They can cause dizziness and lightheadedness. Potassium-sparing diuretics. Examples of potassium-sparing diuretics include spironolactone and eplerenone. These medications are also used to treat heart failure. They have a mild diuretic effect, which means that you will need to pass water more often. They help to maintain a balance of salts in your body. Possible side effects of spironolactone may cause enlarged or tender breasts. This is called gynecomastia, diarrhea, and also reduced kidney function. Statins. Examples of statins are atorvastatin, simvastatin, pravastatin, and rosuvastatin. These work by reducing the amount of cholesterol your body makes. You should avoid grapefruit juice if you are taking a statin. Possible side effects may include stomach cramps, flatulence, diarrhea, constipation, or nausea. It is important that you speak to your GP if you develop any muscle pain whilst taking the statin. Ezetimibe. Ezetimibe is a drug that may be used as an alternative or an adjunct to a statin. These work by inhibiting the absorption of cholesterol via the intestine. Possible side effects may include diarrhea, abdominal pain, facial swelling, or a rash. Nitrates. Examples of nitrates include glycerol trinitrate spray or tablets and isosorbide mononitrate. Nitrates work by widening the blood vessels, which help to supply more nutrients and oxygen to the heart muscle. They can be short-acting, such as GTN, or long-acting isosorbide mononitrate. They may not be used with Viagra-type products, and if you have any problems with erectile dysfunction, please discuss this with your healthcare professional. Possible side effects may include a headache, flushing, or dizziness. GTN protocol. If you experience any angina-type symptoms, it is important that you follow these instructions. Sit down and relax for a few minutes. Take one spray under the tongue. Wait 5 minutes. If symptoms have not gone away, try a second spray under the tongue. Wait a further 5 minutes. If symptoms persist or you start to feel worse, you must call 999 immediately. Supplements. Generally, the advice is to avoid supplements unless prescribed or discussed with your GP or pharmacist before taking. This is because some supplements can interact with your medications. Help to organise your tablets. It may be useful to buy an organiser to help you organise your medication. It may also be useful to speak to your pharmacist to see if you are eligible for a blister pack, which helps you keep track of your medication. Prescription charges. If you're not eligible for free prescriptions, you can apply for a prepayment certificate, PPC. If you need 2 or more prescriptions a month, then you can save money. They can be purchased either online or in a pharmacy registered to sell prepayment certificates, or by phoning 0300 330 1341. Holidays. Make sure you take enough medication for the holiday, plus a few extra in case of delays. Carry them in your hand luggage along with your GTN, and take a copy of your prescribed medications with you. Remember, do take your tablets as prescribed every day. Report any side effects to your GP or pharmacist. Don't stop taking your tablets unless advised to by a doctor. Don't buy any medicines from a chemist without telling them about your prescribed medication. This includes pain relief such as ibuprofen or diclofenac and cough and cold remedies.